morning to everybody. We were getting started there a little bit. Technology is always so much fun. But anyway, we want to say hello to you this morning from the Bartlesville Public Library. And we are so excited that you're here joining us for our insurance educational series one more time as we explore today the ABCs of Medicare. I know there are so many people out there who are wanting to sit in today because they are a little confused about what is available, maybe how they fit into the picture, what really happens here in Oklahoma with Medicare. And we have a specialist today for you from Phoenix Insurance, Karen Monroe, who was here last week, and she's going to tell you everything she knows about Medicare. Right, Karen?
I'm going to get as close as I can.
Okay. Well, we want you to know that the Insurance Education Series is brought to you by the Literacy Services Department of the Bartlesville Public Library. I'm Joni Elmore. I'm a literacy advocate, and I work up here with a wonderful group of women who do so much to help our community have programs for wellness and health and fitness and wonderful cooking classes. Plus, we do all kinds of other things with ESL and ELL students and reading. So we are helping Oklahomans to become more literate in more different areas, and this is another one that seems to be a confusing area. So we have Karen Monroe with us. I wanted to let you know that Karen is an independent agent from Phoenix Insurance. She's been a work comp adjuster, so she's been on that side of the business. She specializes in health insurance and Medicare, and she has a master's degree in business. So she has a lot to share with us, so without further ado, may I present to you Karen Monroe from Phoenix Insurance. Thank you for being here with us today.
Thank you for having me, Joni, and Bartlesville Public Library, the literacy services that are available. I do appreciate that. And we're going to get started on the ABCs of Medicare. I do have a PowerPoint presentation that is available that they may be posting on the site at a later time. ABCs is the foundation of anything. You've got to know your ABCs in order to navigate through English system, language system. Anything starts with the basic ABCs. And that's what today is about, is just to give us the basics of ABCs of Medicare. So, for starters, first letter in that alphabet is A. Medicare Part A. That is going to be part of your original Medicare. That covers your hospitalization. You have an annual enrollment period that you may hear that question also. Annual election period. That is a time every year when you are eligible to make changes to whatever Medicare policy you have, whether it's original Medicare or Medicare Advantage, changing prescription drug plans, things like that. Authorized representative, you may see that terminology. An authorized representative is someone who is legally able to represent you for any legal matters. It's not just someone that you live with, not just a spouse, but it is someone who is legally able to represent you in any legal matters. B, you have Medicare Part B. Your Medicare Part B is going to be for your medical services, your durable medical equipment, any tests, anything that may help with your health. A beneficiary, you, the Medicare recipient, is the beneficiary of Medicare. And the benefit period. Every procedure has a benefit period in which, after you reach that, you have a certain number of services or visits that you can go during the benefit period. And at the end of that benefit period, then the situation might change a little bit. C, Medicare Part C is also known as Medicare Advantage. You have co-payments that go along with some of the prices some of the things that you have to pay. Your co-payment is going to be a set amount that you're paying on certain services and procedures. Co-insurance is going to be a percentage that you're responsible for. Typically, with original Medicare on your Part B, Medicare pays 80%, and the individual, the beneficiary, has a 20% co-insurance to go along with that. Covered services. Not every procedure or service is covered, but there is a place where you can go to see if your services are covered. And that is going to be Medicare.gov. D. That stands for Medicare Part D, which is your prescription drug plan. Dental care and dentures. Typically, Medicare does not cover dental care, nor does it cover dentures. However, typically you can get some supplemental insurance and even some Medicare Advantage plans that they do cover your dental care. Durable medical equipment. Durable medical equipment is going to be anything that you may need, such as wheelchairs, a bed, or walkers. E. That stands for enroll. When it's your time for Medicare, go enroll. Electronic health records are kept online and used to keep all of your records in one location. Eye care. Medicare covers glasses after a cataract surgery, but in general, on your annual eye care visits, those are not covered. Typically, those are not covered in traditional original Medicare. However, some Advantage plans, they do have vision care included. And employer group health coverage. If you have employer group health coverage, in addition to Medicare, that changes the way that Medicare is paid. Or sometimes Medicare is going to go first, and your group health is going to come in next. F, formulary. Your prescription drug plans have a formulary that they use to determine what tier and what level of coverage your drugs are going to have. Fraud. It's all around us. It's everywhere. It is something that you have to be careful of and report if you are feel that you have been defrauded in any way. And flu shots. Medicare covers your flu shots. G. Guide. Everyone who turns 65 will receive or have access to a Medicare guide that's Medicaring you. Government insurance comes into play whenever it's coming in with Medicare. You may have TRICARE, you may have VA benefits, you may also have Medicaid services available to you. That changes the way that Medicare comes to you. And guaranteed issue rights. There are certain times when you are guaranteed the right to have Medicare issued. H. Health Maintenance Organization is something that you may have heard of, or HMO for short. That typically is going to be with your Medicare Advantage plans, but there are some networks that also work as an HMO. Health Savings Accounts, or HSA. Did you know that once you start receiving Medicare, you can no longer contribute to an HSA plan? However, you are still eligible to take any of the funds that are in your HSA account and use those for the remainder of the time that that account is available. Hospitalization. That is something that is covered under your Medicare Part A. Anytime you're an inpatient, your hospitalization is covered. Hearing aids. Typically, original Medicare does not cover hearing aids. However, there are additional ancillary products that are available in addition to some Medicare Advantage plans that do have that built in. Initial enrollment period. When you turn 65, you have what's called an initial enrollment period that starts the 3 months before your birthday month, the month of your birthday, and the 3 months after that. And all of that will become effective on the first day of your birthday month. There are also some other times when you may still be working and you delay the start of your original Medicare Part B. In that instance, that may alter your initial enrollment period. Inpatient care. Inpatient care is when you are actually admitted to the hospital for more than 24 hours. Insurance payments. There's a lot of scenarios that go along about how the insurance pays. If you're working, if you only have Medicare, if you're under 65, over 65, there's a lot of scenarios, and that's on an individual basis. And then IRMA. IRMA stands for Income-Related Monthly Adjustment Amounts. And what that is for your Part A, your Part B, and your Part D. You may have additional amounts that you're required to pay based off of your income level. J, join Medicare. Join the groups that are available and jot down any questions that you may have for your physician, for your doctors, for your medical professionals. Jot down those questions and ask those experts. Know your rights, know what's covered, and keep your records safe. L, we have late enrollment penalties. No one wants to pay additional money because they've been late on something. But there are late enrollment penalties that go along with that. There's late enrollment penalties for Part A. There's late enrollment penalties for Part B, in addition to Part D. And those can range anywhere from 1% per 12 months that you were eligible that did not take that, up to 10% per 12 months that you were not eligible.
Okay, I have a question about that late in.
I have a question in the audience, just a moment.
Okay, so, if you work past your retirement age and you're getting your insurance through your employee, that doesn't count as being late. When you go to the Social Security office, they said you just have to let them know when you do decide to retire. You have to give them, 2 weeks? Do you know?
That is something that is a good question. The question was if you are still working even after you turn 65, when you're eligible, working as long as you have credible health coverage. That is the main factor there. If you're still working and you don't have any health coverage, then you become eligible for Medicare when you turn 65. If you do have the group health coverage along with that, that is something that it would delay. You continue to have the credible group coverage, and that will delay what your eligible period is to get that Medicare. So in that instance, there would not be any penalties along with that. Good question. Thank you. And lab services. Not every lab service is covered by your Part B. However, there is a way that you can go onto Medicare.gov and you can actually check to see if your lab services are covered. And now we are to the middle of the alphabet. M, that stands for Medicare. What is Medicare? Okay. Medicare is you've worked hard to get this. It is your health coverage that's available for some individuals in certain circumstances. that are under the age of 65, but especially for those that are 65 and older who have met certain guidelines for them. Everyone's looking forward to receiving their Medicare number. That is a unique specified number directly for that individual. Medicare Advantage, that is your Medicare Part C, which has the same workings as your Medicare Part A and Part B. And it also, most of the plans do include a Part D, which is your prescription drug plan. Medicare supplements are those, it's a supplement to your original Medicare, and it's also known as a Medigap policy. You have a Medicare summary notice that you receive every 3 months as a Medicare beneficiary. You can receive that in the mail, or you can also access that through a place, Medicare.gov, where you can create your own MyMedicare.gov account. 1-800-MEDICARE is a number that you can call for any questions that you might have, and that number is 1-800-633-4227. MyMedicare.gov will allow you to find all of your related claims, any procedures that you have had, anything that the doctor has prescribed, your lab results. It can become your online portal. Medicare authorization forms are also located there. When you are unable to take care of yourself, or you need assistance getting the help you need, that is where you go. You can legally authorize someone to become your representative in your healthcare needs. And you would access MyMedicare.gov to find those forms. Medicare also covers the mental health conditions that are plaguing our nation. In non-discrimination notice, there is no bias in the distribution of the Medicare services. And nursing home, your nursing facilities are a place where you may have to live later in life. Original Medicare. Your original Medicare is your Part A, which covers hospitalization, and your Part B, which covers your medical services, skilled nursing facility, and durable medical equipment. Premiums. Everyone wants to hear about premiums. Premium is the amount that you are going to pay for a particular product that you have. For your Medicare Part A has most of that, if you're qualified, is premium free, but there may be a premium with your Part A. You have a premium with Part B. You have a premium with Part D. And you may have premiums with any of the ancillary products that are not included with your Medicare plans. Penalties. We talked earlier about the late enrollment penalties. There may be penalties if you do not take advantage of the services that are available when you first become eligible. And preventative services. A preventative service is a procedure that you can do which allows for treatment of any said condition that may come as a result of that test or services. And that is covered under original Medicare. Q, quality of care. Everyone deserves the best quality of care that they can receive. And there is an appeal. There are appeals that are available if you ever feel that you have been not received the quality of care that you deserve. Questions. Always ask your healthcare provider and always listen for the answers. You may always come up with a question, but don't hesitate to ask your experts for the answers, because they're the ones that can give that to you. R, review health coverage in your prescription drug plan. Every year you have the ability to go through. You can go to mymedicare.gov, make sure everything is going well, or you can talk with an agent. You can make sure that everything is still going right with your health coverage. Your healthcare provider can do that. Referral. Sometimes you may have to be referred for certain services in certain medical plans. Railroad Retirement Board. That is one of the ways that you can actually need to contact in order to start Medicare if you were with the railroad. And retiree health insurance. This is another way that if you are on a retiree plan after you've retired and your employer offers that, that may also change the way and when and the time when you go with original Medicare. Social Security Administration. That is going to be your first step. That is going to be your first step in getting original Medicare set up. Sometimes it comes automatically, but sometimes you have to put a little bug in the SSA's ear to get started with Medicare. Or just ensure that it's going to start at the right time. Skilled nursing facility. That is one of the things that is covered under your original Medicare Part B. And special enrollment plans or periods. There may be certain circumstances which warrant a change in the Medicare plans that you have set up. There's a long list of different circumstances that could create a special enrollment period for you. T, telehealth. Everything is going to online visits to minimize the exposure to individuals or diseases or things that are out there. So a lot of online presence is coming up. Tests. Not every test is covered, but you can access Medicare.gov and you can find out if your test is covered. Your physician would also have that information. Travel. Most of your plans, Medicare, original Medicare, does not follow you if you decide to travel, especially outside of the United States. There are some Advantage plans and there are some supplements that allow for that coverage, but again, that is specific to the individual. And TTY is available for all of these programs. You, urgently needed care. That is always available to you. V, vaccines. That's important as we get older to protect us. Vaccines are covered under original Medicare. Vision. Vision may not be available in all of the plans, and that may have to be picked up as an additional. Videos. There are videos to watch to help any health coverage issues. You can go to YouTube, but you can also access Medicare.gov, and it will have videos available to show you. W, welcome to Medicare preventative visit is something that you are eligible for once you reach that age where you are eligible for Medicare. Wellness visit is something that you're eligible for every year. As you go to the doctor once a year, you are eligible for wellness visits. And wheelchairs and walkers, that is part of the durable medical equipment that is covered under original Medicare Part B. X-rays, that is a covered service under original Medicare. And extra help is available for those who do need that extra help. Y, you. This is your time. This is your benefit. This is your health coverage for the future. Your health is important to keep you going. Become the new Gen Z. Get your Zen on. and get ready to Medicare. Enjoy life and live it to the fullest. And now, what questions might we have? One question that did come up earlier is a lot of people may start receiving a lot of ads, mailings. They may see a lot of things on TV. They are going to become so just overwhelmed with it. The markets, the advertising markets, they can't just specify a certain area or a certain zip code or anything like that. It is something that is mass produced and it goes out. Unfortunately, you have to contact, you have to look into it because not all plans that you see coming up are available for all areas. So it is something, it is individualized.
So you're saying that, all states do not offer the same plans to the, residents within those states?
That is
or
correct.
zones,
That
right?
is correct.
Okay.
States have, they may have the same plans, but it may not be all plans available to all people, all areas. There's a lot that goes into that to decide on that. So it is, again, you're gonna have a lot of questions coming up about what's available to you, and that's something that you have to go to the agents.
Okay.
I have a question about the travel. You said that it doesn't cover travel from state to state, like we're in Oklahoma, but if I go to Georgia, is my Medicare not gonna take care of me if I get sick there?
The travel within state to state, as long as you are within the United States, your Medicare plan is going to cover you any place that accepts Medicare. It is going to follow you, anywhere as long as they accept the Medicare. If they don't accept Medicare, then that's something you're responsible, but you might be able to work with an appeal process on that certain or whatever service.
Okay, thank you.
Thank you. Also, about your presentation, I've got 3 questions that came up, so you can answer these in order, and then we'll put other questions out here. It said that TTY was available. Can you, specify what TTY is? That's question number 1. It said that extra help was available. Can you differentiate the specificity of that in regard to, many people think that means that Medicare will pay for extra help to come into your home to do this or that? Or, what services might be provided and covered? And the other one is about vaccines. There's a lot of confusion about vaccines. For instance, the shingles vaccine, is that one covered? So there are specific vaccine questions that I've heard from people that they have heard, well, no, that is not covered, that you can clarify all that for us, okay?
Okay, so TTY is the telephone system that is set up for the hearing impaired. They have interpreters that are available that can actually help communicate between verbal and the nonverbal community. There is a guide, especially Medicare.gov, there is a TTY list that is there that the hearing impaired can actually contact, and they can make access and be able to have the same conversations with someone and be able to understand what is going on. The second one on that, talking about the home health, any extra help that's available. The extra help, they may have dual special needs. They may have certain criteria. They may have end-stage renal disease. They may have there is something that may work with another government agency to help give them the help that is there. Home health, hospice care, some of that is part of original Medicare but again, it's on an individual basis.
Okay, so when people hear about home health, partial parts of that may be covered and others may be not.
Yes.
Okay.
It's based off of the needs and the condition of the beneficiary that actually determines, and it is the healthcare provider that determines to what level and what coverage they allow.
And then the vaccines, like shingles, and some of the more specific ones, Prevnar 23, Prevnar 13, some of those that come up that you go to your doctor's office and they say, have you had this such and such? And, are those covered? Just speak to that for a moment.
One of the best things you can do if a physician is telling you that you need a vaccine, you need to be asking that question, is this going to be covered with my Medicare? Because not everything is covered, not every service, not every procedure is covered, but that is again something that you need to be asking those questions with the physician and making sure that that physician is aware that you need to make sure that it's covered under Medicare.
And just a little tiny plug for our own health department here in Washington County. If some of those things are not covered, many times they're offered at the health department, either at a lower cost or sometimes even free. We have a wonderful health department here in Barnesville and Washington County, so that's a good place to check as well. Also on durable medical equipment, I had a personal experience where a particular piece of machinery that I needed for rehab for my arm when I had rotator cuff surgery was not covered by Medicare. And as I found out from other people who were had that surgery, it was a very important part of the recovery. So people really need to check into that before they say yes or no, because that would have been an out-of-pocket expense that was pretty high, about $500. So make sure that people know whether their durable piece of medical equipment that they need for surgery of recovery is actually covered or not.
Always ask those questions. There is not going to be a silly question, a stupid question. It is something, that question is going to be there to help you get the answers that you need, because again, not everything is covered, not every procedure, not every test, not every vaccine. But your healthcare provider is going to be able to help give you that information.
Great. Any other questions?
I have one. This is more like an education about the base benefit. Person is 65, has to apply for Medicare, or if you go to 66 and all that. I mean, if you have to apply for program and you're at 65.
You're not,
Let me repeat that question in case somebody
Sure.
can't hear. If you are 65, must you? Do you have to apply for it, or can you apply or enroll at a later time?
it is something that this is a health coverage that is a benefit to you for all the years that if you qualify, you've met the qualifications. It's something, it is a benefit to you. So it's advantageous to apply, but again, you're not required to take it. If you have met your requirements, typically your Part A is going to be premium free, so you're not paying anything on that. Your Medicare Part B, if you don't have insurance, that's going to help with your insurance, taking care of any medical procedures that are covered. Whenever you don't take that, and then you may be healthy right now. You may get hurt tomorrow, and then that's going to bring about a lot of medical issues that just continue to build. And maybe you need it next year. So in order to keep that, if you're not afraid of taking the penalty or being penalized for not having it, then that is your choice. That's your right. You're not required to take it. But But just knowing that you're not gonna be penalized if you're eligible and you choose not to take it, there are consequences at the end of that, whenever you do take it.
Yes, ma'am.
So if you don't sign up for Medicare B as in boy or B as in drug, and you get when you can, when you're first eligible, will you be penalized ongoing?
That is something that the penalty is assessed, and that continues as a penalty. We were talking about, the Part D penalty is a 1% off of the national base, which is right around $33. That information is available in your guidebook. But that continues on your monthly premiums throughout the rest of the time that you have that.
That penalty?
That penalty will
So,
continue.
okay, so let me, repronounce your question. If you do not sign up for medical, B or D at your initial enrollment time, then you could incur a penalty that will last and be added onto your premium for the entirety of your Medicare coverage till death do you part.
That is correct.
Okay.
But I was told if you are still working, you have insurance.
So that's one of the qualifying factors. If you're still working, you can address that.
It goes, whenever we were talking about if you have group health insurance, if you have, just because you're working doesn't mean that you're working and you're gonna continue until 70 and then you're gonna retire. If you didn't have health insurance, if you didn't have what's called credible coverage, then you became eligible when you turned 65. So if it's going for a Medicare, the Part B, the penalty on that is a 10% for every 12 months that you were eligible and did not take it.
But if you have credible insurance,
If
you're
you-
not penalized.
If you have credible coverage, you are not penalized if you delay getting your Medicare.
I think this is a good question because people are working longer and they have coverage sometimes through that employer for an extended period of time or until they officially retire. And if they go over the age, if they work past 65, although Medicare would be available to them if they did not have coverage from their employer, they are not penalized if they continue with that employer's coverage during the time that they're still working up until their retirement. So, these are such specific questions you can see sometimes, why Phoenix Insurance might be available to you to answer questions at any given time. Let's talk also for just a moment. I always think it's very interesting about Medicare, that one of the things that most people incur after a certain time in their life, maybe let's say 65 or after, is vision issues and hearing issues. And they're rarely ever covered. So let's speak to which things are covered. I know that certain medical diseases and initial examinations are covered, but then many times you get to, oh, you need this or that, and it's not covered. Can you talk about that a little bit? About hearing and vision?
There are some plans through, that do have the vision, they have dental, they have things that are built in. Not every plan, has something like that. It is something that it is an individual choice. What they call ancillary products, they are available on an individual basis. If a plan does not cover those things.
Okay.
So,
Now, oh, yes,
yes, are you saying that a supplement would cover dental, vision, and, hearing, or are you talking about a Medicare Advantage plan, which would be your Medicare C, which takes the place of your original Medicare?
There are Medicare Advantage plans, Part C, that does include, there are several that do include dental, vision, and hearing aids, some of those things that you may need as you get older. Your Medicare supplement or the Medigap policies do not include them, and typically they have to.
You have to buy them separately.
You have to buy those policies separately. Can you guesstimate how much more a person is going to pay that's added on to their Medicare A, with an Advantage plan, and are those mostly available in Oklahoma, or is that by region, or you probably have spoken to that, but this is where all the confusion comes in, okay?
That's where it gets to where it is based off of a county. And not every county in Oklahoma has access to every policy. So again, it's an individual that they have to determine what is available in their area.
So let's say a person is on Social Security. That Medicare payment is going to be extracted, usually from your Social Security, and it's minimal, but then when you add on an Advantage plan, that's going to come out of pocket and you're going to pay extra for that, right?
That is something that the cost is incorporated into a Medicare Advantage plan. Because your Medicare Advantage plan covers Part A and Part B. And it picks up the Part B.
So another specific question. So the competitors to the Advantage plans, are they the secondary insurance companies such as Blue Cross and Blue Shield, Aetna, any of those? Are those the competitors? Are those the different companies that people would be making a choice either to have Medicare Advantage, or maybe there's another policy that's offered by a secondary company? Is that what people have to make a decision on?
That is something that not every carrier, it may not be available, may not be something that they can look into, and it's an individual basis on that.
Okay, so what we have determined,
So
yes.
what we know is that the companies like Blue Cross, Humana, United offer supplemental plans that complement your original Medicare. Medicare Advantage is operated by private insurance companies that incorporate some of these additional benefits. But they're not always, what Karen's trying to say is they're not always available to everyone. For instance, in Washington County, where we live, there's only one Medicare Advantage option, correct? And so people in Tulsa might be saying, oh, I've got this great plan and it's a zero premium and blah, 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 and it gives me the bus to go to the doctor, etc. But we are governed by what's available to us by the county.
I think that is the most specific information that I have heard that helps people. Is that some things that are available out there in the big world aren't available to us in this specific county, Washington County.
Right.
So I think one thing that we have truly determined is that the Medicare system is wonderful, yet it's a little bit complicated. And we need help with it many times. And I know that sometimes as people are approaching that 65 age, there will be seminars. I've seen those things sometimes advertised in the paper. But we do know that you can always call Phoenix Insurance, and they will carefully help you one-on-one with decision-making in this area. So we're so thankful for that. Any other questions before we close? Anything else that you would like to cover, Karen?
There's always going to be a question. Don't hesitate to ask the question. That's how you get that knowledge.
Yeah, there is a lot of questions. Anything else, Lori? We have Lori Rowe here with us, who is the CEO of Phoenix Insurance, and I think Lori knows everything. So she says no.
I'm always coming up with questions.
Oh, yeah. Well, we want to thank our audience for joining us today. And feel free to submit a question on the Facebook page if you would like, and we'll try to get an answer to that. Were there any other questions on our Facebook page? Okay, none at this point. We thank you for being a part of our literacy services department with Bartlesville Public Library. We try to offer all kinds of health and wellness information to you to help you become a more healthy individual, and of course to help Oklahomans. You know, I've told you many times that we don't always rank as high as we would like to, and that's why we offer so many advantages here with our healthy cooking, our healthy exercise, and our health and wellness classes. So your Bartlesville Public Library is always here to help inform you. We are so thankful to Phoenix Insurance for bringing us the Insurance Educational Series. And next week, we have a very special presentation by Lori Rowe, which is, tell us, Lori, one more time.
Who gets grandma's yellow pipe plate?
Who gets grandma's yellow pipe plates? I love this part. This is how to distribute heirlooms and how to do this in a way that helps your family, helps you, and is beneficial to everybody involved. And it's really a very unique presentation. So we hope you will join us. We want to give thanks to the following for making this program possible: the Institute of Museum and Library Sciences, the Oklahoma Department of Libraries, and of course, your Bartlesville Public Library. So we say thank you for coming today. Thank you for being with us. We hope to see you next week. Bye-bye.